CDC now calls it an epidemic. 22 states and counting are on high alert tonight for the flu. That's nearly double from 1 week ago. With many doctors' offices closed for the holidays, patients this week are being forced to turn to emergency rooms or late-night clinics. Wherever you seek treatment, KXAN's David Scott reports this year's influenza strain is nothing to mess around with.
There have been 15 pediatric flu deaths nationwide, 3 of those in Texas. Doctors are seeing a pickup in flu cases since Thanksgiving. Exposure to holiday crowds makes it all the more contagious. The predominant strain is a mutated H3N2 version, more resistant to the vaccine, but doctors still recommend getting it and warn, don't be fooled by mild symptoms.
A lot of folks have been surprised that they actually had the flu because they've been medicating a lot with the over-the-counter products, and so they don't have those high fevers and deep body aches, but they're really weak. They're very tired. They say it's an effort just to get from, the bed to the bathroom, and that's kind of an indication that it is influenza and not a simple cold.
Texas med clinics are among those providing daily patient swabs to the county health department so they can track all of this. There have been 5 deaths this season in Travis County. If you ignore symptoms, don't load up on fluids, you're vulnerable to things getting worse at any age.
These are not necessarily the very young or the immunocompromised or the very elderly. These are healthy young people who are getting pneumonia with it.
Still, most vulnerable are children 4 and younger because their immune systems simply have not fully developed, and seniors whose immune system may not be what it once was. Now, if your doctor's unavailable this time around, check for the nearest medical clinic. There are dozens in the greater Austin area. Note their location and their hours, and if symptoms persist, they say better safe than sorry. David Scott, KXAN News.